Hello, my name is Nathan Basine. Today I'm going to be giving a presentation on a CDS tool used for hypertension misdiagnosis, which I developed. So for introduction, to begin, it is important to define what a CDS tool is and which problem I'm going to try to address. So clinical decision support, or CDS, provides customized individual specific information to clinicians, staff, patients, and other stakeholders, and it contributes to a better health outcome for patients and doctors alike. So for the problem going to be addressed, so white coat hypertension, this is something that occurs when a person's blood pressure is taken and it's measured as higher than it really is because that person is under pressure, they're nervous that a doctor is in the room with them. So when they would take their blood pressure at home, it might be lower because they don't have that pressure. So this tool will aim to eliminate the possibility of white coat hypertension of occurring in a clinical setting. So addressing the 5 rights of CDS. So there are 5 rights. There's the right information, the right people, the right channel, the right intervention format, and the right time in the workflow. For this CDS tool, I'm going to be addressing each one of these rights. So for the first right, right one, the right information. To ensure that the right information is delivered, clinical history is very important to study and analyze when using the CDS tool. This includes details such as family history, pre-existing conditions, and the patient's lifestyle choices. If a new blood pressure reading significantly deviates from previous measurements, it can be flagged for a retest. This might indicate white coat hypertension, especially if the results don't align with a patient's previous measures. So right two, the right people. For this tool, it is designed to help, like I mentioned, solving the problem of misdiagnosis of hypertension. So the target audience will mainly be nurses and physicians who are taking blood pressure readings. In order for the information for the CDS to be effective, information needs to be delivered to the right people. And the problem at hand of misdiagnosis of hypertension in the short term or in the long term might not seem like that big of a deal, but over time, if there is a misdiagnosis of hypertension, there could be some pretty negative effects. So rights 3 and 4, the right channels and the right intervention formats. Channels and formats are important for CDS tools. Without the right channel, a CDS tool will not be utilized to its maximum potential. An alert that white coat hypertension has occurred for a patient and their blood pressure reading may not be accurate can take place. So let's say a patient has a misdiagnosis, there needs to be an alert telling the doctor or nurse that this happened. One device that can be used is a mobile device to be used as a channel for the CDS tool. Today, almost everyone has access to a mobile device, and we are constantly checking our screens for notifications and updates. It would be extremely beneficial for this CDS system to utilize mobile devices to send alerts and updates to medical providers as well as patients. So the CDS tool itself will aim not to cause alert fatigue. So that is a potential issue that could occur with having alerts sent to mobile devices. So a main goal is to only send notifications only when necessary. So right 5, the right workflow. The main intervention step would be before the measurement of blood pressure is done and following the measurement as well. When a patient checks into the doctor's office, the CDS tool will alert the physician of past blood pressure measurements of the patient. This will act as a metric that a medical provider can use to determine if the patient's readings are accurate or if it's a white coat hypertension occurring. The CDS tool will send an alert after the blood pressure is taken as well, and it will analyze the accuracy of the blood pressure reading. So when getting your blood pressure measured in a doctor's office, there's basically this workflow. So first, the patient arrives at the healthcare facility. Next, the patient checks in with nurses and medical staff. So right after this step, that's where I decided the CDS tool should be implemented. So at this point, the CDS tool will alert the physician of past blood pressure readings. After that, the patient will be taken to the exam room. Nurses will take blood pressure reading. Based on reading, the patient will potentially be diagnosed with hypertension or not. Then again, after this step, there's going to be another intervention. At this point, the CDS tool will be implemented again to compare the blood pressure readings to past results and potentially determine if it's white coat hypertension. If hypertension is diagnosed, then the patient will be given treatment plan as well as medication. Finally, the patient will be further evaluated by the physician. So basically, these light yellow boxes are the interventions that are going to be taking place. So there's only 2 interventions, and I feel like this will eliminate the possibility of alert fatigue occurring, and these are the most effective places to have an intervention. So for my conclusion, this proposed CDS tool can greatly improve the process of diagnosing hypertension in the medical field. This tool will rely on alerts to notify healthcare providers of the possibility and prevention of white coat hypertension of occurring. Overall, if